Fantastic. Look, thank you everybody for joining us today. Might just give it another minute or two, just I can see there's a few people still jumping on, and then we'll get going. But just while we're waiting for those, so look, agenda for today, thank you very much for taking time out of your valuable day. Essentially, agenda for today, really just very quickly just to touch on exactly what RxTro is, where it's moved from and going to, and how this really relates to the current trends that we're seeing in the primary care workforce. I'm going to take you through a few examples of the GPCE survey results that we ran in Melbourne on the weekend, and really how this facilitates the changes that we've made to RxTro to really help you to get out of those meetings. So I'll just give it one more minute, as I can just see there's a couple of people just joining in now, and then we'll kick things off. Fantastic. So I think that's pretty stable now. So we'll get things going because I know that everybody's got places to be. So essentially, really just to touch very quickly on exactly what RxTro is and what it's looking to achieve. And that's fundamentally seamlessly connecting life sciences and medical professionals. So what exactly that means? So RxTro has been around for close to 10 years or slightly over 10 years now, actually. And really what it started was replacing the paper-based planners that a lot of clinics were using to facilitate their industry appointments, so their non-patient appointments. In the last 10 years, it's facilitated over 2.2 million HCP discussions, and really taking the learnings that we've come out of the last 10 years, we're really looking at what it is today and what it is into the future, which fundamentally is a piece of software that allows you to set up your preferences to get the most out of the valuable time that you allocate. So in terms of getting the most out of the time, really what we mean by that is obviously related to the current primary care workforce trends. And really the big thing that we're seeing is obviously the importance of staff retention. We've got a database of every single HCP in the country, and really where that database comes from. One of the other strands to what we do here at RxTro is we actually manage all of the mailing lists for both Medical Republic and AusDoc. So what this means is that when a doctor moves or when a new practice opens, this is something that we're constantly updating. But what it also gives us a line of insight over is when doctors leave the practice or join the practice, and it really gives us an understanding of the workforce trends that we're seeing in primary care. We've been doing this for about 3 years now, and as I say, really kind of purpose of today to present this back to the industry in a way that's meaningful and really shows you what this means in terms of staff turnover and staff trends. In terms of the number of practices in the industry, what we're seeing is that overall it remains fairly stable. So we're seeing that on average there's about 20 new practices that are opening each month, and on average there's around 20 new practices that are closing each month. So what this really means is that the number of buildings that are out there competing for the GP workforce is remaining fairly consistent. When it comes to the number of GPs that we see, what we're seeing is that competition is really becoming quite clear. So the turnover rates in the industry, there have been around 10% for 21 and 22. But what we've seen is a big change this year where it's grown to around 24%. Now, there's two reasons that what we see is that doctors typically leave surgeries. They're either moving to a new practice or they're retiring and leaving the workforce. And what we're seeing is an increase in both of them. So essentially, what we see is that when it comes to doctors that are just leaving the workforce or retiring completely, this has consistently grown from 3% in 2021 through to 6% and through to 10% in 2023. This is a little bit different to the percentage of doctors that have just left one practice and moved to another. So essentially in 2021, it was 7%, down to 5% in 2022, and up to 13% in 2023. But fundamentally, what that means for you as a practice manager or a practice owner is that the reality is around 24% of the workforce has actually changed over this year for one reason or another. So essentially developing that environment of staff retention, it's 5,000 additional people that need to be recruited, which essentially is where we're sort of looking. One of the big things that's often pointed to as well is the sort of change in practice size. What we saw was that this was pretty consistent across the size of practice. So essentially, the larger practices, call it 6 or more GPs. It was around that national average in the greater than 10, slightly below in that 6 to 10 GP practice. And once again, for the call it 5 and under, slightly larger and slightly lower in the solo GP. This is sort of the information that we're really seeing from the data that we collect around kind of managing mailing lists and making sure that the relevant documents being sent to the right person. But what's really interesting as well is that we saw this in line with the most recent RACGP Health of the Nation report. So this was a survey that was conducted from the 26th of April to the 31st of May this year. It was based on roughly 2,500 participants. And what we saw here was that it was consistent with the changes that we were seeing in terms of the workforce. So essentially, 71% or 7 out of 10 GPs actually reported feeling burnout with remaining high. And the big thing with this, 64% were considering either reducing their time they spend practicing, or even considering leaving the practice altogether. The other group that we see within this is that almost 3 in 10, or 30% of GPs, intend to retire in the next 5 years. So really what this means is these early trends that we're sort of seeing in the data that we collect is certainly being reflected in a lot of the leading indicators around the GP workforce that's coming through in really the survey and the sentiment data. Really, we've got a great opportunity here with a group of people on the webinar, so we thought it could be a good opportunity just to run a quick poll. So I'm going to share that now, and we'll share the results at the end. Fantastic, so that should be live. So what does this all actually mean? So as I say, as a practice owner or a practice operator, really what you're facing is an environment where you're seeing an increased turnover and an increased number of GPs coming into the practice. So fundamentally, where we see RxTro's sort of charter as connecting life sciences with medical professionals and really fostering that environment of a learning-based practice. One of the things that we did over the weekend was we attended the GPCE in Melbourne at the Exhibition Centre. It was a great opportunity to really talk to doctors directly about exactly what they wanted to get out of the time that they allocate that's non-patient time in terms of the practice. And we collected 55 total responses, and the question that was being asked was, what categories of industry appointments would you like to see more of in your practice? The results that we had were very, very consistent. And essentially the number one category that doctors were asking to see more of was the CPD category. Is there the opportunity to have CPD-based activities in the surgery that essentially, instead of sort of needing to run out on a Sunday, essentially can be done in surgery? The second category was specialists. So these are local specialists, local private specialists that are setting up and really kind of a meet and greet style meeting where it's an introduction and going through from there. The other categories that we have in the system, pharmaceutical reps, the allied health and practice management based tools, certainly there was a number of GPs who indicated that they did want more of those meetings, but there's a clear trend towards the CPD and the specialists. As I mentioned, RxTro has been around for close to 10 years, and fundamentally it's had over 2.2 million HCP interactions facilitated through it. Within the system, everybody's grouped up into these high-level categories, and essentially what we sort of see here is the number of people that are available compared with the number of appointments that are booked. So what's interesting with this, at the moment, the appointments that are made available, roughly half of the users are pharmaceutical reps. But what's really interesting is that they take 80% of the total appointments. In contrast, the specialist services, roughly 17% of total users, however, are only taking around 9% of total appointments. So when we sort of look at this data and we see that these are the sort of trends that we see in the system, really kind of, and the fact that it's not aligning with what it is that the GPs are directly asking for, essentially that causes us to take pause and go, how do we configure the system to really make sure that you guys are getting the most out of the time that you're allocating? Just to give you an example of some of the different specialist groups that are currently on the system and seeking an audience, and as I say, these can range from specialist meet and greets to CPD-based programs. There's a wide range of all the major hospital groups that are out there working to seeking an audience and looking for opportunities. So essentially the major changes that we've put into RxTro, we've added in 2 new categories. So fundamentally, the purpose for this is that you can select your preferences at the top, but importantly, you can actually make different times available to different audiences. The first category was the CPD provider. Now within this, and I'll go into the criteria in a moment, but essentially within this, there's companies like the ones that I just mentioned on the slide before that fundamentally are able to provide in-surgery, self-reported and accredited CPD-based activities. The second category that we added in was the medicinal cannabis providers. And one of the reasons for this is that what we were finding was that it was typically a polarizing product. So essentially, we were hearing it from both sides in that there was often, if there was 10 doctors in the surgery, there might be one particular doctor that is interested in that particular area, and the other 9 doctors really aren't, or potentially even the 10. But by doing this and creating these new categories that you can either tick to allow or allow at different times, what it means is that you can really tune those preferences to make sure that everybody's getting the most out of the meeting. So as I say, what this does, I'm just going to jump into the system and show you what this looks like in a live environment. So as I mentioned, everybody's grouped up into these high-level categories. Now, the way this can be used is that under, for example, allied health provider, what you'll see is that there's different tiers of categories. So if you're a surgery, for example, that has an on-site physio and you don't want other physios coming in, essentially you can deselect that category and the system will sort that out for itself. Excuse me. As I say, if anything at a top level, you can untick or tick, But the important thing and the major change that we've made is that now you can make specific appointment times available to specific audiences. So when you make specific appointment times available, you've got the ability firstly to do either group-based appointments or individual-based appointments. So keeping with the medicinal cannabis example, if we've got a clinic and we've got 10 doctors in it, you might want the opportunity just to make an individual appointment for one of the doctors just available to medicinal cannabis providers. This means that the people who are operating in that space will just come in to see the doctor that has a particular interest in it, and essentially it doesn't bother any of the other doctors. Conversely, what you might want to do is set up an appointment time just for CPD providers. So essentially it might be a last Friday of the month, and basically only people that are booked in who have self-reported or accredited CPD can actually access that slot and book that in. The final component of control that you've got is really this approval required section. So for example, if you wanted to make the last Friday of each month available for CPD based activities, but you firstly wanted to approve that, you can set that up, and then fundamentally, before anybody can actually book into that slot, they actually need to send a request through to yourself, who will then jump on, and essentially you can approve or deny it. So what this means is additional level of control. Where this is aiming to get to is that instead of sort of seeing that 80% of appointments are taken by one particular category of representatives, by making different times available to different representatives, hopefully what we can see is a bit of an evolution in the system whereby it aligns more with what the doctors are expressing that they want, which is more CPD, more specialists, and hopefully getting more and more time out of the meeting. As I mentioned, providers will be required to, prior to being admitted into the category, they'll be required to either submit their proposal as to how they're either an accredited CPD activity that they're discussing or self-reported. If it is self-reported, then they'll need to basically substantiate, which will be populated into the system, and you can see they'll need to substantiate exactly what part of the measures that the self-reporting is saying. Is it measuring outcomes? Is it reviewing performance or educational activities? So in conclusion, what we're seeing is that basically the competition to attract and retain GPs, it remains tight, and it looks like it's only going to get more difficult as more and more GPs leave the workforce. The feedback that we receive from GPs is that they want more meeting with industry, and in particular with specialists, and in particular CPD-based activities. Establishing a stimulating work environment and ongoing training has been shown to increase staff retention, and fundamentally, RxTro assists you in facilitating this. So how does it do it? RxTro makes it makes these meetings easy to administer. If you've set up an account, you can log in and set it up right now. Alternatively, if you need some assistance, we're here to help. But look, we're currently going through the list of industry reps that we've got that is quite comprehensive, and really assessing the suitability of the company for the new CPD category. So as I say, really a good opportunity with the number of people that we have on the call to open it up to questions, and obviously happy to here to help. Fantastic. I can see that there's a question coming in. The question was is there going to be a recording made available after the meeting? And absolutely. So what I'll do, I'll leave it another moment just to see if there's no further questions. How many CPD providers are in the system? Absolutely. Great question. So essentially, in terms of the system, basically, there's over, I'll show you the screen again. So most of the major hospital groups that we work with are in there and offer CPD-based activities. So as I say, this is in-surgery CPD. So essentially, we're working through with these hospital groups at the moment to essentially get them into this category and so forth. So I don't know the exact number, but there's quite a lot. Do we get a certificate at the end of this? Great question. So this is the difference between the accredited CPD activities and the self-reported CPD activities. So for the accredited CPD activities, really the expectation should be on the provider that they're automatically logging it with your CPD home. So I'm sure you'll get a certificate, but you shouldn't even need one. Essentially, with the self-reported piece, often these are a little bit more varied in terms of how many hours you actually spend on the initiative. And this will be a case of really kind of you assessing that and using it to put that in. Are all the CPD providers offering free visits? Yes, another great question. So absolutely. So in terms of the people who are on there and using RxTro, so as I say, essentially it's they're actively going out to see customers, and this is provided to you guys for free. So the purpose of it is really to kind of develop those networks, those referral networks, which are obviously important for the specialists. So yeah, absolutely. Just a question if they can have a copy of the PowerPoint slides. So yes, absolutely. So after this email, what we'll do is we'll send through a summary of the slides. Also happy to include just a copy of the RACGP Health of the Nation report, just because it obviously aligns quite closely with a lot of the leading indicators that are sent in that. Fantastic. Well, the questions seem to have died down slightly. So if there's nothing further there, happy to leave people to get back to their day. Fantastic. Well, look, everybody, thank you very much for joining us today. I know how busy you guys are. So look, and I know what taking 20 minutes out of the time of your day. So as I say, really kind of next steps, if you're an existing RxTro user, looking at the list, there's a lot of people who are currently set up with RxTro accounts. If you're an existing RxTro user, you can log in right now and basically get that set up. If you're not a RxTro user, you can log in and get that set up as well. And essentially, if you want some help for the first time, happy to reach out and provide any training. There's been a final question that's just come in around, is there anyone in the practice that can use RxTro, and is there a charge for it? So RxTro is made freely available to practices, so it doesn't cost the practice anything, fully integrates with best practice, and essentially anybody in the practice. So we can have multiple users set up, we can have the receptionist set up, we can have the practice manager set up, and everybody can be notified around the meetings that are occurring. Fantastic. So look, as I say, really next steps, we'll distribute the slides with the information. Thank you very much once again for attending, and yeah, we'll look forward to speaking with you soon.